To this, October is Breast Cancer Awareness Month. Breast cancer is the most commonly diagnosed cancer among women worldwide. Each year, more than 2 million women are diagnosed, and over 650,000 lose their lives to the disease.
These aren't just statistics. They represent mothers, sisters, daughters, and friends who deserve hope, dignity, and support.
But there is encouraging news. Breast cancer death rates in the U.S. have dropped by 44% since 1989. That progress is no accident. For decades, Breast Cancer Awareness Month has helped raise visibility and inspired millions to take action.
Joining us now, Dr. Leigh Vinocur, a board-certified physician and author of Never Let Them See You Sweat, and Monica Yeschek, a breast cancer survivor and director of marketing at the Promise Fund. Welcome.
Thanks for having me.
Monica, thankfully, you survived your battle with breast cancer. Tell us what that experience was like and how you got through the treatment process.
Thanks so much for having me this morning. So I was diagnosed during COVID, which was a wild time for all of us. And so no one was allowed to come in with me during the process. And when I found out, the oncologist looked at me and it said, "Do you have someone here with you?" And I said, "Well, no, I came by myself. I'm not allowed to bring anyone." And she said, "I'm here to tell you you have invasive ductal carcinoma." And I thought, "Can you tell me that in English? I don't understand what you're saying." And so it was a experience in itself, and I ended up being referred to Ambassador Nancy Brinker because the first phone call that I made was to my aunt, and Nancy got on the phone with me immediately and said, "Stop right there. You're going to get a second opinion." And she ushered me into a different entity to get that second opinion. And thank goodness she did, because I ended up having a different course of recommended treatment as a result of the advanced screening that I was provided, because when I was originally diagnosed, it was small town, and so they didn't have quite the technology as they did where she sent me. And that was roughly 4.5 years ago. I opted for a double mastectomy, and I'm here grateful to be here with all of you to share awareness for all the women out there.
Yeah, we appreciate your triumph. And Doctor, Breast Cancer Awareness Month is about promoting screening and reducing risks. What advice would you actually provide women to protect themselves?
Yeah, absolutely. It's an empowerment for women and their health, and you hit the nail on the head, and congratulations, Monica. If you catch it early, the 5-year survival is 99%. So it's number one, it's important to know your risk factors. There are some things that you can't change, whether you have the BRCA gene or CHEK2 or family history or your age. But there are other things you can change, like cutting out alcohol, smoking, managing your weight, because we know obesity contributes to it, and exercise. And then the screening is critical. You know, usually women will start at 40, but if they have risk factors, they maybe have to start earlier. And then knowing warning signs, you know, doing breast self-exam during different times of your cycle so you know what your breast feels like, any lumps, any discharge, the skin, if you have dimpling of the skin, that's critical. And men get breast cancer too, so they need to check out lumps. And then of course, there are, some health disparities. We know African American women have a 40% higher death rate. So it's critical to make sure that women can have access to screening and to treatments. And new treatments are coming all the time, right? But we have to remember 300 NIH and National Cancer Institute research funding was cut this year, and some of it was breast cancer. So we have to continue with this October awareness to put pressure on the federal government and say it's so important to have this research for new treatments so people like Monica can continue to live long, healthy, happy lives.
Yeah. Monica, Breast Cancer Awareness Month can mean very different things to different people. Some, it's inspiring, but for others, it can be overwhelming in terms of a month reminding them that about a disease that changed their lives forever. So what does this month mean to you personally?
Great question. You're right. You definitely, have some PTSD that comes into play. And so you put on the pink, but you do it for yourself and for everyone else, because we all need to get screened, and we're all sort of in it together as it relates to being healthy and being the best version of ourselves.
So true. And doctor, looking ahead, what is the future of breast cancer research, treatment, and the potential for a cure? And I'll add, what can men do to better support women to get screenings and things of that nature? I know we should listen. That's always on the table. But what more can we do?
Well, absolutely. As I said, research is critical, and making sure and putting pressure on the federal government and our representatives there to make sure that we continue to do research. That's what this month is all about, because new cures are coming all the time. Things like targeted therapy, where we really look at the genetics of the breast cancer and we find specific targeted therapies. And then access to care is critical. Every woman should have access to screening, access to care and treatment if they are diagnosed with breast cancer. So having men support that too, and just having the public throughout this month putting pressure on agencies to continue the fight for breast cancer. And don't forget, men do get breast cancer. It's rare. It's much more rare than for women, but that's something that they should think about too. They're not immune.
Yeah, definitely something to think about, and thanks for raising that. What message would you share, Monica, with women who have just been diagnosed or who are currently undergoing treatment for breast cancer?
I'm going to share the wisdom that was shared with me, and it was to stay the course, hang in there, and circle with your people. Rely on those that you already have great relationships with, whether it's your family, your friends, your colleagues, whatever that circle is. Stay in that circle and rally in order to put one foot in front of the other, because the survival rates have gone up so significantly that you focus on the future and you will get through it with your crew.
You know, doctor, in the closing discussion, I want you to actually break it down in terms of how does the breast cancer start? You mentioned a particular gene in your initial comments so that people can better understand their risk level and what to look out for.
Yes, so if you have a family history, it's probably important to get some genetic testing to see if you have the gene, because there are certain genes that really predispose you to breast cancer. But the truth is, you know, the majority of women, somewhere around 80% or 85%, really don't have a family history and don't really always have the gene. And the key is, you know, as with any cancer, you know, our body constantly, as we age, our DNA breaks down and we create cancer cells. And sometimes, you know, our body surveys it and our immunity takes care of it, but sometimes it doesn't. And the research is critical to find new reasons, new causes, new genes. You know, just because we can identify CHEK2 or the BRCA gene, you know, that took a while. There are probably other genes that are out there. When we say the majority probably don't have genes, we don't know every gene that affects it. And that's why continuing the research is so critical, and advocating for patients, for the research, for the scientists who do it. It isn't just the scientists. It trickles down to new treatments for women and men all throughout the country and the globe.
Yeah. Dr. Leigh Vinocur and Monica Yeschek, thank you both for sharing your stories as well as your insights. Appreciate it.
Thank you.
Thanks for having me.